Today topic, and the topic is suicide, what everybody needs to know. And my name is Dr. Asim Shah. I am in Houston, Texas, United States. I am professor and executive vice chair, Barbara Gorkin Chair in Psychiatry, Menninger Department of Psychiatry at Baylor College of Medicine. Also, I'm chief of psychiatry for Bentraub Hospital and Harris Health System. So again, I'm here with today's topic, which is suicide, what everyone needs to know. So let's just start with if the suicide rate in the United States is increasing or decreasing. So this is really a question for the audience. What do they feel is happening? Truly, if you look into the statistics, and the reason I'm talking about that is that these kind of questions usually come in USMLE and other exams. Suicide rate in the United States, unfortunately, has been increasing since the last about 20 years. Before 20 years, meaning before 1999, it was almost the same. But in the last 20 years, it has been increasing and steadily increasing and increasing. So there is no drop or decrease in the suicide rate in the United States. If you think about Center for Disease Control and their statistics, suicide today in the United States is the 10th leading cause of death for all ages. 10th leading cause of death for all ages. That is a big number. And more importantly than that, if you are between the ages of 15 to 24, and some people even say if you are between the ages of 15 to 34, it is the second leading cause of death in that age range. The first leading cause is homicide, but the second leading cause of death is suicide between the ages of 15 to 24, and some people say between the ages of 15 to 34. Again, these are kind of questions which people ask in USMLEs or different exams, but really the rate is increasing and it is the second leading cause of death between the ages of 15 to 24 or even 34. Just think about last year, 2018, 2017, there were close to 47, 48,000 deaths by suicide in the United States. Why I'm focusing on United States? The reason I'm focusing on the United States is, first, I am here. And second, statistics-wise, United States is a country where stats are available. It is very difficult to get accurate stats even in this country for suicide, forget about countries like Pakistan. Now, when you think about suicide, as I mentioned, about 48,000 people die of suicide every year in the United States. But about half of them, or more than half of them, 51%, die from suicide which is caused by guns. So guns or firearm are the number one and the leading cause of death, which result in suicide. Think about that. Everybody says that why United States has so many mass shootings. United States has 1/3 of the mass shootings of the world. 1/3. Why? Because the United States has only 5% of of world population, but 1/3 mass shooting. And the reason United States has 1/3 mass shooting is United States has perhaps the most guns in the country. In the world, this is the number one country with guns. Population of the United States is about 300 million. The number of guns in the United States is over 300 million, which means every single person has one gun. Usually what happens is some people have 4 or 5 guns and others don't, but on an average, these guns are more than one per person. So in the United States, we have most guns. And because of the guns, mass shootings happen. A little bit about mass shooting, if you want to think about it. Mass shootings are defined as shootings which result in more than 4 deaths at the same place at the same time. If you have death from a shooting, and the deaths are more than 4 at the same place at the same time, that is called mass shooting. It usually happens at a place which is busy, like businesses, mosques, churches, theaters, food courts, malls, and schools. It happens in areas which are busy areas. So the point I was trying to make is that guns are a serious problem in this country, and 51% of suicide happens because of guns. 28% may be suffocation. Example of suffocation is basically hanging. 14% from poisoning, which means whether it is an overdose or it is some other insecticide poisoning, and other 8% are other reasons like carbon monoxide poisoning. If you think about an inpatient psychiatric unit, the number one cause of suicide in the inpatient psychiatric unit is usually by hanging. So if you think about it, about 12 suicides happen per 100,000. It's a lot of it's a lot of suicide, and there are 13 suicides per 100,000. So every single day, about 129 Americans die by suicide in this country. So if you even think about it in terms of minutes, every 12 minutes there is one suicide in this country, and every 40 seconds there is suicide worldwide. So suicide is a huge, huge, huge problem. Now, when we talk about suicide, in my mind, we need to focus more on survivors. Studies show that most of the time people try to commit suicide, but they survive a lot. So, for every one completed suicide, there are about 25 attempts of suicide. Also, studies show women try more than men. So, women complete suicide less than men. Men complete more because they usually use firearms. So if there are 50,000 deaths because of suicide every year, about 250,000 people are suicide survivors. Think about it. 250,000 people are suicide survivors every year, and the number one risk factor for a future suicide is previous attempt. So again, think about it, that the number one risk factor for a future suicide is previous attempt. So if somebody tried suicide today, they didn't succeed, they will try again. We need to save those people from trying to attempt suicide in future. That's the number one thing we can do. Another thing which is happening in this country is opiates. Opiates, which can be heroin and other prescription pain medicines, are the leading cause of death under the age of 50 in this country. Leading cause of death under the age 50 in this country, especially in areas like East Coast and Vermont and New Hampshire and those areas. And we can prevent those because people are taking these pain medicines and getting it from the streets and abusing them. And that causes a lot of natural meaning, accidental death and suicide death. So a lot of time people ask the question, is suicide a abnormal phenomenon or a normal phenomenon? Or in other words, they ask that, does everybody who commits or tries to commit suicide has a mental illness or a psychiatric disorder? So answer is, not everyone who tries to commit suicide has a mental illness. Most of the people who try to commit suicide do not have a mental illness. They try to commit suicide because suicide is an act of impulsivity. You are impulsive, you try to commit suicide, meaning it can happen in 30 minutes, 1 hour, 2 hours. Impulsive people try to commit suicide. Yes, people with psychiatric illness also try to commit suicide, and we'll talk about that, which psychiatric illness can cause more suicide or not, but mostly it is impulsive people. So what would be the risk factors of suicide? Studies show that elderly white male or being an elderly white male is a constant risk factor for suicide. So old age is a risk factor. Studies also show women attempt more suicide than men, but men are more likely to succeed. And I mentioned previously, the reason men succeed more is because of firearms. And again, these questions usually come in USMLE different steps. So to remember, women attempt more, men succeed more, elderly white male is the number one stressor. Again, if you think about people who are close to religion, whether it is Islam or Judaism or Christianity, people who are close to religion usually commit suicide less because there's no religion which allows or permits suicide. So what would be the long-term risk factor for suicide? If you recall, I mentioned earlier that the number one risk factor for suicide is prior suicide attempt, meaning if you have tried to commit suicide in the past. Then you have people who are depressed. They try to commit suicide maybe about 20% and they succeed. People who are using alcohol try to commit suicide 50 times more. They may or may not succeed, but they try that. People who live alone and are isolated also try to commit suicide. People who do not have social support try to commit suicide. Also, people who are separated, divorced, or widowed, they also try to commit suicide, and that's also very common. People who don't have a job try to commit suicide. People who may be retired try to commit suicide. And again, if your socioeconomic status is low, meaning you are becoming poor, you don't have money, you may try to commit suicide. That is seen in Pakistan also. If you don't have good health, studies show if you have backache, chronic pain, people try to commit suicide. People who constantly feel hopeless try to commit suicide. Also, people who don't have kids at home try to commit suicide. So, in other words, having a child at home is a protective factor. People who are impulsive obviously will do something impulsively, and suicide may be an act of impulsivity. So, again, recap people who have prior suicide attempt, history of mental illness, whether it is depression, schizophrenia, personality disorder, alcohol abuse, who live alone, who are isolated, who don't have social support, who are separated, divorced, widow, who are unemployed, who are retired, who have poor health, who feel hopeless, who don't have kids, and who are impulsive. All of these things are risk factors for suicide. And if you combine one, two, three, then it becomes even more common. So let's just focus on mental illness. As I mentioned, people who have depression, 15% of them may try to commit suicide. People who have bipolar disorder, 20% of them may complete suicide. So overall, with mood disorder, whether it's depression or bipolar, the incidence is 15 to 20%. Out of this 15 to 20% completed suicide, depressed people commit suicide when they are coming out of depression. You need to have certain amount of energy to commit suicide. It doesn't happen without energy. So you need to have certain amount of energy to commit suicide. Second, alcoholics. 18% of them complete suicide because this is a population in which they don't know what they're doing and they may try to do that. Schizophrenics, 10% of them may commit suicide. People with personality disorders, especially borderline personality, 5 to 18% may try to commit suicide. So mental illness is pretty strong with suicide, but it is not the only cause of suicide. Again, high risk is when you're depressed, but you're coming out of depression, or when you're schizophrenic, but not psychotic and demoralized. Another group which is very significant for suicide is physicians. Being a physician, you need to think that suicide is very common in physicians. So think about it, which specialty it is the most common? Dentists have the highest suicide risk. Female physicians have 4 times as high risk of suicide. 4 times. Why? They have to work at the job and then they have to go home and take care of home. Very stressed. And again, in terms of other physicians, psychiatrists are the highest. So number one risk is dentists, surgeons, psychiatrists, female physicians. Very high risk of suicide. What would be the commonest method of suicide? If you recall in one of my early slides, I mentioned that firearm is the most common way of suicide. Over half of suicide are because of firearms, about 18% with hanging, and about 10% or so with pill ingestion, and less than 8% with gas inhalation. So if you see, the numbers are here, 55 to 60% firearms, 14% by hanging, 11% by ingestion and poison, and 8 to 9% by gas, which is carbon monoxide in most cases. So what do patients who commit suicide, what kind of warning symptoms, signs they do or give us? About 2/3 of them would tell their spouse, their husband, their wife, that I'm not feeling well, I'm feeling like life is not worth living. Always remember, they will first talk to their spouse, 2/3 of them. Half of them will talk to their relatives. 18% of them will talk to their doctor or therapist. Not everybody will talk to their psychiatrist because psychiatrists may or may not be approachable. So 2/3 of them will talk to their spouses, half of them will talk to their relatives, 18% will talk to their therapist. We talked about the risk factors for suicide. Let's just talk about protective factors of suicide. So people who feel that they are responsible for their family, they don't commit suicide because they think, oh, minors are at home, kids are at home, and I cannot do it because who will take care of the kids? People who are married don't do that because they fear that if they are done, they're gone because of suicide. Who will take care of their kids or family or wife? People who are afraid to kill themselves. People who have a fear of unknown. Religious beliefs, like I mentioned, no religion allows suicide. Every religion looks down at suicide. People who are future oriented. If somebody is planning that, oh, I'm going to go to a trip to Turkey or Europe or something next month, they usually are not the ones who will commit suicide because they're future oriented. People who try to get help, meaning have a help seeking behavior. Also, people who have pets, whether it's a dog or a cat, that is a protective effect on suicide. So let's just talk about suicide letter. So how do you assess a patient with suicide? You basically ask them, how bad do you feel? It's perfectly okay to ask them a question like, do you wish you were dead? It's also perfectly okay to ask them, do you have thoughts of ending your life? It's also okay to ask them, do you have thoughts how you would do it, how you would end your life, and how close you have come in ending your life? All these questions are perfectly normal, do not increase the risk of suicide. How do you assess suicide? So you try to see when were they thinking about it, what precautions did they make, did they call somebody for help or somebody called for help, did they write a will, a suicide note? Suicide note is always a bad sign. Are they trying to get help? Did they communicate with somebody? So if you have a person who is trying to get help, that is a person who you can invest more, because these are people who are very good that they will get help. As opposed to a person who tries to hang self, doesn't tell anybody, writes a suicide note, and somebody finds them hanging accidentally. They may survive, but those are more at risk, because those are the people who you won't be able to do a whole lot because they are not communicating with anybody. So remember, people who are communicating with people are a better patient to treat as opposed to people who are not telling you anything. So, what is patient's report of suicide attempt? A lot of time patients say purpose of their attempt is to maybe get attention or do something. They don't know what to expect with suicide, and they don't know what interventions would be made. So you have to clear that. What were you thinking when you try to hurt yourself? Were you thinking you will die? Were you thinking your boyfriend, girlfriend will come? Were you thinking your misery would be over? You don't know. So you need to ask those questions. So you need to check what their plan is. Was the plan lethal? Was it something which they could carry on? Meaning, if somebody wanted to shoot themselves, did they have a gun? Somebody has a gun, they need to be taken care of. Gun needs to be out of their house or their possession. Did they do any rehearsal? Another question which comes up in a lot of time in board exams or so is, what do you do with these no suicide contracts? No suicide contracts will give a false sense of security. They are not research supported, and they cannot be held in court of law. So if somebody says, let me go home, I'm not going to commit suicide, they leave your office and they immediately shoot themselves. Who's responsible? Guess what? The person who had the non-suicide contract is responsible. So these contracts are not responsible. Please get people help. And two kind of population we are very well always. One is kids. Anybody who's less than 18, if they say they want to hurt themselves, we always get help. Why? They're impulsive. They can do something to get attention in their impulsivity. Second group is people who are postpartum depression. They can be psychotic, get them help immediately. They can be bipolar. We don't wait in these two populations. We get them help and we hospitalize them immediately. And elderly people who have access to guns. Guns are the number one issue. Again, to summarize, risk factors are being a male, problems with family, no job, unemployed, hopeless, feeling worthless, anxious, using drugs, suicide plan, and came very close to killing or carrying that plan. So, in summary, suicide is something in which anybody can die from. You need to know your patients well. You need to document the risk. You need to consult with colleagues, and always think that suicide is an act of impulsivity. It can happen because of depression. It can happen because of schizophrenia. It can happen because of alcohol or drugs, but it can happen without any mental disorder also. It is the second leading cause of death between the ages of 15 and 24. Some people say even 34. We need to be very, very careful in assessing suicide. Asking questions about suicide does not increase the risk of suicide. You can certainly ask questions about suicide. Guns are the number one way people kill themselves, but they can do it other ways too. If somebody has a gun and they have no social support, they are being hospitalized. With this, I'm going to end my presentation, and my email for any questions is aashah at bcm.edu. Again, it is A. Shah at Baylor College of Medicine, bcm.edu. A. Shah at bcm.edu. I hope you learned something from this lecture, and if you have any questions, feel free to email me. Thank you.